This is Stephanie Tessa recording for PYC 522 Workshop 4.5, the preceptor presentation. This is a 27-year-old female chief complaint with a migraine headache. Her health physical illness is she has had headaches. They have gotten better, but now they are worse. They have gotten worse after the birth of her second child, more frequent and more severe in pain. She says they have not been this bad since she was 15 or 16. She has a headache every 2 to 3 weeks, and it lasts about 2 to 4 days. She does not have a headache at this time, but when she does, she has nausea, vomiting, and the headache has a pain that throbs. Her past medical history, she's had headaches since she was 12 years old for the past 15 years. She's been in the ED 3 times this past 6 weeks, and she states she gets a shot for the pain. There is no mentions of medications taken. She also has brought her children to this appointment with her, and she has to stop frequently to correct the 18-month-old from roaming around the room, getting into drawers and everything, and that does seem a little stressful for her. Her social history, she's married, has the two children, 18-month-old and 5 years old. She works part-time as a cashier at the local CVS on weekends, and that's when they're watched by her father. He is a truck driver and on the road 2 to 3 nights a week. When she talks about it, it seems a little stressful also. The review symptoms, she has a headache, pain, that's usually on the right side, temporal parietal region, occasionally pain on the left. She denies any dizziness, weakness, blurred vision, or double vision, denies any nausea, vomiting, diarrhea, constipation, or heartburn. She denies any fatigue when she's not having the headache. She states other than when taking care of the kids, but everyone is tired when they have 2 children, aren't they? She's not lost or gained any weight. She denies depression or anxiety. Her weight is 145 and her height is 5'3", temp 98.2, pulse 88, respiratory 20, and blood pressure 132/86. Her physical exam is Perla. Her TMs are unremarkable. Her nares and pharynx are benign. No lymphadenopathy or thyroid swelling. Her lungs are cleared auscultation. Her heart is regular rate and rhythm without murmur, rub, or gallop. Abdomen is soft, non-tender, blood, bowel sounds ×4. No peripheral edema, and her neurological exam is completely negative. The differentials I would use for this is a migraine, possibly temporal arteritis, tension headache, and also sleep deprivation, and a cluster headache. The tension headache, I don't think it could be because of the tension with raising kids and possible sleep deprivation as well, but she's not complaining of a pressure band-like around the head, and there's not much throbbing sometimes with the tension headache. It's more like pressure, and she's complaining of the throbbing. The labs I would do is an ESR and a C-reactive protein to rule out temporal giant cell arteritis, but I don't think that's likely because she has no vision disturbances, no fever, no scalp tenderness. The main thing I believe she would have is a migraine, and because it's unilateral. It is a right temporal parietal region, occasionally on the left, and she's also having nausea, vomiting with throbbing pain with that. The treatment I would recommend is avoid tobacco, caffeine, or alcohol, avoid stressors, obtain a daily regular sleep routine, take Imitrex 25 milligrams PO ×1. If no relief in 2 hours, may repeat ×1. That is the end of my presentation. Thank you.